MySASH, we serve a community of about 535,000 patients, and of that we have over 150,000 patients signed up to MySASH portal, and with over 100,000 of those patients being paperless. We're really proud at SASH of our portal because of our really successful uptake. We went live with our outpatient appointments, clinic letters and discharge summaries, as well as a pre-assessment questionnaire and some health record features. And at Go Live, we didn't limit the invitations to just patients having an outpatient appointment. We were the first trust to invite anyone who attended the hospital through ED or as an inpatient to sign up to the portal so they could view things like their discharge summary. We did have a portal already, but it's very limiting and there weren't many patients signed up to it. So when we could see the functionality of the new portal, it was an opportunity for us to include all our patients rather than exclude. Hence why we wanted to open up the bracket of patients who could sign up for the portal. And as you can tell from our numbers, that has been our biggest success. In one cohort, we sent them text messages and we did a countdown to tell them that the portal they were on was coming to an end and that they needed to register with a new portal. And we also took time to think about how we didn't disadvantage those patients in terms of what they saw currently on the portal that existed and what they would see on MySASH. So we migrated 2 years of historical data for appointments so that they could see their past appointments, so that when they moved across, they could still see what they'd seen. We did quite a big campaign where we texted patients to tell them to sign up, and we did a really good comms piece. We had lots of visibility in our patient waiting rooms with posters and information. It was a very successful implementation. We're having an event for our admin and clerical teams for them to come along, have a little talk, learn about the portal, how it interacts with the NHS app, what we publish onto the portal and what we don't, and just really get some more knowledge and confidence to be able to have those conversations when patients ring up and have queries around what they're seeing, whether that's the NHS app or the portal, because for some patients they don't understand the difference. So it's just to give our admin and clerical teams the knowledge to be able to deal with those inquiries. Introducing the library and guidance alongside the meet and greet gave us an opportunity to be able to publish a lot of patient information for the patients to read at home, not necessarily send it in the post to them anymore or give it to them when they attended. We started off quite small by just publishing URLs to our internet pages, which directed the patient to the correct page for that particular specialty. But we've been working with our pre-assessment team to improve the information and grow our library. So we now have a really well-established sort of library on pre-assessment, including anaesthetics. So we've had lots of input from our anaesthetic team. We're now working with our surgical team, and we've just updated our trauma and orthopaedic guidance to give the patients a lot of information around hip replacements and knee replacements. And we're finding it a really helpful library to be able to tell the patients, go to your portal, go to this section, and you'll have these documents that you'll be able to read, or this information, or this website that's really got a good video on it. So we're really starting to get really good engagement from the services on this part of the portal. We always focus at SASH on our patients. They're our central focus, and I think for them, one of the biggest benefits is they get their appointment and they get their information in real time, and there's no delay with postage or anything like that. So they've got instant access to see that they've got an appointment, or to see that we've received a referral, or to see that their clinic letter's ready for them. The other benefits I think we're seeing is it supports our trust screen plan. It also reduces the manual tasks for the admin and clerical team, and also there's the paper and postage. That's one of the big advantages of using the portal. We recently onboarded our cardiac investigations team for their appointment letters, and I'm currently working with all divisions on their pre-assessment and waitlist letters, so their TCI letters for theatre, and the radiology team as well, to onboard them and obviously get their letters onto the portal. And with radiology, we're opening up a new community diagnostic centre in July, and we'd really like to take advantage of using the portal for self-booking.